Okay, we are going to
All
start.
good, Amy?
I got
All
it.
good?
Okay.
Okay.
Thank you. Okay.
That's okay.
See, I told you we got technical support in the background. We're going to start.
From London.
We're going to start recording this because I will post it up on our YouTube channel and send a link to everybody so you can watch this later. And so I'm going to breeze through these slides pretty quick, especially with the PPP. So its design was to keep America working. Its design was not to help. It sounds wrong, but it really isn't about helping the employer as much as it is about helping the employee. They want the employers to keep paying their people. And so that's what it's for. What they were doing is giving you 2.5 months worth of payroll cost to cover you for a 2-month period. So they gave you 2.5 months of payroll and you have 8 weeks to spend it. It can be 100% forgiven if you spend it in the following 8 weeks on very specific cost. It's for employers that are small businesses as defined by the SBA, which is in general 500 or fewer employees, which includes self-employed and contractors. They can file on their own. And you must have payroll expenses or net earnings as a self-employed individual to be considered payroll. So if you have a property company and you own some property and you pay no wages, it doesn't work. It doesn't qualify. 501c3 is allowed, and in general, less than 500 employees. I did do some further research on this because there were a lot of code sections referenced in the Act itself. And what I found for the home health and hospice segment, so if your NAICS code is 621610, that can be found on your tax return. But if that's your code, then the way they define a small business concern is if in total you have less than $16.5 million in annual revenue for your entire group, okay? So some of you PAS providers that maybe have a lot of employees, you might qualify under this special rule right here. But definitely want to seek guidance, please. I am not an attorney, and if that is you definitely need to get professional help with that to make that determination. You must have been in business on 2/15 of this year or prior. And again, it does include sole proprietors, independent contractors, and self-employed. So this is what's defined as payroll in a nutshell. It's going to be your wages, some sick pay, but it also includes your health insurance premiums and your retirement benefits. And your SUTA only. It does not include the other employer taxes that you pay. It is prorated. You can only allow up to $100,000 annual for any employee. And that doesn't mean in the 8-week period, you paid them $100,000. It means if you paid them at that rate over the whole year, you've got to scale it back to basically $100,000 salary, okay? And it does not include, like I just said, employee comp over 100,000. So you are allowed to count the first 100,000, just you have to exclude anything over that. Some people have misinterpreted this to mean that you have to completely exclude that employee that is over 100,000, and that is not the case. And when I say some people, I don't just mean providers or CPAs or attorneys. I mean some bankers. We saw a banker excluding those employees. And so the bankers, nobody knows all of this yet because there's just not been enough time to really absorb it and get all the guidance and clarification. Typically when a new law is passed, it takes a whole lot longer. And then it's about 2 years after that point for the guidance and the real regulations to be established. And we've been checking daily and getting daily updates from the Treasury on, they're calling it their frequently asked questions, and that's where they're giving us clarification on a lot of these things. So you can see this is all, they've tried to make it happen very, very quickly, and it's led to a lot of confusion. Now, like I said, you've got 8 weeks to use this loan, these loan proceeds. And it is a loan until you prove that you met the qualifications for forgiveness. You do sign loan documents and everything. So during that 8-week period, the 8 weeks starts the date you get funded by the bank, okay? And it counts your payroll costs that we previously defined, which is all of your wages, basically all of your wages. It doesn't include mileage. It doesn't include office reimbursements, expense reimbursements. It includes some family sick leave. It does not include the expanded or emergency family sick leave. But then in addition to those payroll costs, you do get to spend in 8 weeks, you also get to use it to cover your rent, your utilities, or any other interest that you have on debt that was incurred before the period, or mortgage interest. Now, all of these things that you're spending it on have to have been in existence prior to 2/15. Utilities we've got defined as electric, gas, telephone, internet. On my nursing homes, they have cable for their staff. I included cable because to me it's kind of cable internet. This definition of transportation, that is not mileage, and honestly, I probably should take it out for our local region, but I really think it applies more to the Northeast, where they have like a transportation tax, and the what they pay that covers kind of more like public transportation. So you have 8 weeks to spend it on all of this for it to be forgiven. You can have up to 100% forgiven, including the accrued interest, because again, it is a loan, and that loan is a 2-year, 1% loan. So while you have it, it's going to accrue 1% interest. Some of the stipulations, you have to maintain the same level of employment as you had before the crisis. This still needs a whole lot of guidance. I've seen a lot that refers to this 2/15/2020 being the target date. It might be arguable that maybe you can argue that we were good up through, May 15th, or not May, March 15th. The banks, we don't have much guidance on this yet. There's some language that talks about this period, and that doesn't make a lot of sense, especially if you're like a new provider and you're ramping up. Bottom line is, and what you really want to focus on, is they're trying to make sure that you maintain the same level of workforce. If you don't, they will prorate how much can be forgiven. Let's say you had 100 employees, and by the end of your 8-week period or 6/30, that still has not been clarified. The law states 6/30 is the date. So maybe they're gonna, because if your loan got funded this week, your 8 weeks is gonna be over before the 6/30 gets here. But the law still says that you've got to reestablish by 6/30. So to me, my interpretation as it stands now on the guidance we have available is you don't have to, hey, I got my loan, I got to rehire everybody, but you've got to work back up to that point. So to me, it's going to be snapshot. A snapshot at 2/15 versus a snapshot at the end of the 8 weeks. For me, that's the conservative approach. That's what I'm trying to push my clients towards. The way the law reads, it might be as late as snapshot at 6/30. So again, you just got to get your employment levels back up to that level. Now, let's say you started with 100 employees, but you can only get back up to 80 employees. So you've had a 20% reduction. Well, they're going to limit your forgiveness by 20%. And so 20% of that, of what you actually spend, that's all legitimate, 20% is not going to be forgiven because you didn't get back up to the full employment. I know you guys are going to have lots and lots of questions about that. And there's just not a lot of guidance out there yet. And then also you must maintain the same salary levels. You're allowed to decrease them, but not more than 25%. And there's some language in there that worries me because it says for any given person. So to me, that means even if you have one person that you reduced more than 25%, that could affect your forgiveness, okay? So really the goal is you spend all the money you can on the allowable expenses, you maintain the same level of work. Now, if you're one employee shy of forgiveness and you don't have any work for them to do, you can still pay them, okay? So those are some things. It doesn't say they have to be working. They just have to be paid. Again, that's why I say that the language in this bill was really driven to keep the employees paid so that they can pay their rent and buy their groceries and keep the economy moving forward. Okay. I heard a analogy this morning with some of my CPA buddies. This is going to be a lot like tax planning. You know, if you do tax planning right at the end of the year, before the year is over, you do a projection, you know where you are, and you know how much money you either owe, they owe you, and you make some changes based on that. Any of you guys that were providers in home health way back in the cost reimbursement days, you remember this. Every quarter we did an interim rate review, right? And we looked at how much money have you spent compared to your limits, blah, blah, blah. Do you have any expenses you need? Let's go spend some money, buy new computers, whatever it was. So there was planning. This is going to be the same way, because what everybody is experiencing right now is still a lot of panic, confusion, fear, and they're thinking, oh yeah, 2.5 months payroll, I need that and it can cover me. Okay, that's great. But spending 2.5 months of payroll in 2 months is more of a challenge than you realize, especially if you have a large payroll. If your payroll isn't very big and maybe you pay high rent, it might offset. But if you have large payroll, there's really some planning that has to be done to figure out how that's going to materialize and how you're going to spend it all. And so what we're doing is we're creating a plan and we're tracking it with every payroll and updating it with real numbers. So you're going to have the planning. You've got to execute on whatever the plan is. And then you've got to document everything. And what's great is you guys are accustomed to documentation. But what I worry about is on this loan, everything's got to be documented. And it's not just this loan. When we get to that provider relief fund, there's some scary language in there. And so everything has to be documented. You have to keep really clean, clear records. How can you prove that that $500,000 PPP loan you got that you deposited into your regular bank account and you just paid payroll? How do you prove that you spent those proceeds on payroll and not your other proceeds? Or not your other revenue. I can see it getting really, really sticky, and we have zero guidance on this yet. We're just using our professional judgment on, how we've seen IRS, how we've seen Medicare treat things in the past. So you're going to want to make sure you do everything you can to really clearly document how you spend that money. And there's going to be a forgiveness process where you go through and you've got to basically prove up, okay, yes, here's what our payroll was. Here's proof that we paid our payroll. Here are our payroll tax filings, whatever that proves up, you paid your payroll. Your rent, all of those, you've got to be able to prove it and justify it. And then you've also got to certify that you did that, right? So they're kind of doing some honor system, but not just that. This is the last point here is the honor system, and points 1 and 2 are you proving it up, okay? They're going to ask for a lot of information. We actually have one lender ask for all the insurance invoices even before they got the loan. So going to be asked for documentation of this. So what if you don't get forgiveness, right? Well, that's not the end of the world. And everybody has different risk values and toleration of risk, but they also have whether they want loans or not. And so you can, anything that's not forgiven, you've got 2 options. You can pay it back immediately. There's no penalty for early payment, or you can keep it out on a loan at the remainder of the 2 years, 1% interest. I have seen the first loan documents that I've seen come out so far, and that is a true loan document. And the loan term, so if it was today, then the maturity date is 2 years from today. So you're going to have 8 weeks to spend it. You don't get to start the 2-year period over again. It's going to start from when you first get it. and it's at 1%. You can't buy money, you can't get money like that from anywhere else. So if you need that, that's cool. If you, there's nothing that says you can't pay some bonuses to your staff. Again, can't be over $100,000 staff, but maybe some of your field staff, maybe some of your supervisors, maybe some of your people that have really stepped up for you during this time, those might be some planning opportunities that you have there. Okay, real quick before we do have quite a few questions, and I think I'll just leave them. Well, let me see if I can answer some real quick. I'm going to keep an eye on the clock. If somebody is fired for discipline reasons or quits during the 8-week period, yes, you can be penalized. So sure, it doesn't matter, but if they were fired for disciplinary reasons, you should be rehiring, replacing them. It doesn't have to be the exact same people. It's a head count, right? Or if it's really an FTE count. So let's say, for instance, you've got a PRN nurse and she quit working, but one of your existing nurses picked up her shifts or her visits. You're down in head count, but your unit count, your FTE, your hours worked is still the same. And so you're pretty good there. So what I already applied for earlier is null and void. No, that is not true. Well, we don't know yet. So with the PPP loan being shut down, we don't know how the banks are handling those. I think every bank's going to be different. The SBA lender that I'm working with, they are still processing because they are 100% confident more money is coming. And what they're hoping is that they can get caught up with processing while the government works out their deal. So I am not yet, only a handful of loans that I was involved with got funded. They were all with small banks. None of the big banks have funded anything. The SBA lender we're working with is very large. They haven't funded anything to any of my clients. And they're saying to just hold steady and persevere. They say just there's more money coming. So I don't think that means that it's all, you're just SOL, right? Let me see what else. So the question is your beginning PPE, your beginning FTE count versus your FTE count at the end. I will be honest, when we initially submitted our applications, it was before April 3rd. So the FTE number we used was for the average of 2019. The banks that we've worked with have then wanted the average for the 215 payroll. I think that's going to be adjusted. And I think when it comes forgiveness time, it's going to be from about the 215 payroll to whatever and we don't know if it's the ending of the 8 weeks or if it's the 630, which a lot of stuff says 630, but if that's past your loan, your 8-week period, I'm not sure how they're going to handle that. So we don't know the answer to that yet. We have 2 more. Okay, we have 2 more employees today than we had then. No, that is not a problem. That's a good problem to have. So if you've got more employees than you did back then, perfect, nothing to worry about. Okay, I'm gonna have to come back to the one with the multiple entities. Okay, next question. ERM software is not considered a utility. And I think, Tracy, that's a real good question. Does the payroll have to be paid out or earned in the 8 weeks? I think it's got to be paid. We internally, we're using check date, the actual date of the check, not the date the payroll was funded, like, by your payroll processor, but the date of the actual check. Okay, I'm gonna leave the rest until later. I wanna make sure we don't run out of time. So this economic injury disaster loan and grants, a lot of people are calling this EIDL. This one too is also shut down. It appears that they were closely related in where those funds were coming from, because when one shut down, so did the other. I have heard from a very, very few number of people that have gotten this advance, this grant. So I'll get to that in a second. What this was designed for was, it's a loan. It's up to $2 million for up to 4 years. And it's at like 3.75% interest. Again, everything here is for small businesses, which is 500 or fewer, or 16.5 million. And it's all through the SBA. Now the PPP loan, you had to file directly through a bank. SBA, I'm sorry, this EIDL, you're filing directly with the SBA. And what happened was, you go on there and you would basically submit preliminary information, and then it would say, do you want a $10,000 advance? And you say yes, and it says, okay, we'll get back to you. And you put your banking info in there. A few people have gotten that. They changed, because the law says up to 10,000. They decided that that should be 1,000 per employee. And so some people have gotten a little bit of that. I mean, very, very few. I heard one got it just this morning. But again, nobody has even been able to follow through with the actual loan application on this. So this one we still don't know a lot about, but it is a true loan, and it is to, its purpose is to pay for expenses that you cannot use it for the same thing that you use the PPP loan for. And its purpose is to pay for things that you would not have had the disaster occurred, or to help you cover the loss in revenue because of the disaster, right? So it's got to, and the other thing, this is an economic injury loan, which this has been around for a long time. This is a normal part of the SBA process. And part of it states that you have to show that you've been reduced revenues by 50% or more, or considerably higher expenses. So, you know, there's a lot more gray area on whether you really qualify for this or not, and what you've got to do to prove those things up. Again, one of the stipulations, though, and this is why there's so much planning involved, is you cannot use this loan for the same thing you use the PPP. So let's say you get both of them, and somebody asked about your ERM software. That is what this will be used on if you were to qualify for it. So this is that emergency advance up to 10,000. I've changed this. It is now just 1,000 per employee. This does not have to be repaid under any circumstance. However, if you also receive the PPP loan, that advance, whatever you get from the advance, will be deducted from the amount forgiven. So you will have to pay it back. So if you get 10,000 from this, and you get a PPP loan, and you do 100% forgiveness on your PPP, the 10,000 is going to reduce that forgiveness, and you will have to pay that back. So again, as of yesterday, these weren't really flowing. I'd heard one got funded. Today, it sounded like 2 other in my network got funded, and nobody really knows if they've really applied for the EIDL loan yet, for the actual loan, not just the advance. Okay, I probably need to speed up a little bit. This accelerated / advance payments from CMS, this one scares the bejesus out of me, and I hope that those of you that have requested these, they're basically big rat payments, these accelerated payments, really understand how this is going to work. These are, it's a separate, it's a piece of the CARES Act. There's $100 million in relief in it. I'm sorry, it's not part of the CARES Act. The $100 billion in relief is the next section we're going to get to. Medicare providers, Part A and B, can request an accelerated payment. Again, this is Medicare only, up to 100% of your 3-month period of Medicare reimbursement. You request it directly from your MAC, which, you know, in our case is Palmetto here. And the MAC has 7 days to review it and fund the request for you. Here's the catch. It is 100% recouped beginning 120 days from issuance. And it's got to be fully paid back in 210 days. So what's going to happen is you're going to request this. You're going to get 3 months worth of payroll or worth of revenue today, right? In a week from today. That's cool. You're going to just keep billing Medicare. Everything's going to go rock and roll. But in 4 months at day 120, you're going to go on 100% recoupment essentially for 3 months. So you're going to have zero Medicare revenue for 3 months. So you've got to really be smart to take this out and manage it appropriately. Because what are you going to do during that 120 day, after 120 days, when you go on 100% recoupment, because you got to pay this back? Now, you know, I don't know. That needs to be thought through very carefully. So that's kind of what I just went over. All right, this one, I'll be honest, it must be down in the act. So I spent a solid 7-8 days reading that, trying to understand it with about 10 other CPA firms. And I only got through the first 2 things, which was the PPP loan and the forgiveness. That was kind of what I was assigned to. This must have been way further down in the act, because this caught us by surprise, and it was last Friday. A lot of providers started getting this payment, so much so that TAC put out an announcement that, hey, this is legitimate money, here's what it is, yada yada. So what we know now is this is your stimulus payment. It's remitted to the fee-for-service providers. There is a calculation which I did not put on here, and I don't even know it off the top of my head, but basically you take your 2019 Medicare reimbursement and you get that proportionate, whatever percent your reimbursement was of total Medicare reimbursement fee for service, you get that percent of the $100 billion, or I think it was only 30 billion that they doled out so far. So anyways, there's this formula to calculate what you're going to get. And I loved it. I didn't love it, but it's funny to me that the CMS administrator, Seema Verma, came out and she's quoted as saying no strings attached. This is absolutely not true. This probably has more strings attached to it than any of the reliefs that I've seen so far. There is this terms and conditions that you must sign, and so the payments went out on Friday. Not all of them. People are still receiving this. If you haven't got it yet, you know, I don't know why, and not all of my clients got it, but of the ones that did get paid on Friday, they've gotten an email today that asked them to sign this terms and conditions. Okay. There should be some funds coming out for Medicaid. Again, in this total bucket was $100 billion. And as I understand it, they've doled out the first 30 billion. And so I think some of it's going to go to Medicaid. So if you're a heavy Medicaid provider, there may be something coming for you. So let's talk about these terms and conditions. They state, and I took this verbatim, that this is the quote, they are related to COVID-related expenses or lost revenue, but they're to be used to prevent, prepare for, and respond to coronavirus, and shall reimburse the recipient, you, only for healthcare related expenses or lost revenues that are attributable to coronavirus. You're going to have some real documentation required with this. It's a little fuzzy about this $150,000. Okay, what it says is it requires reporting if you received more than $150 total from all programs currently available. So if you did an EIDL loan or if you did a PPP loan and you get this money, not going to take long and you're going to have this reporting requirement. Those reporting requirements are talking about 10 days from the close of the quarter. You've got to prove where you spent that money. And you have to, this terms and conditions, you got to read it and you've got to either accept the money or give it back. And we don't even know yet, okay, well, what if you spend part of the money on those expenses? Can you give back the rest? We don't know. There's just not any guidance out there, but those terms and conditions need to be taken very, very serious. I don't want to be pessimistic, but I almost feel like it was a way for them to come in and catch of okay, well, we were kind of loosey-goosey on these other things. We need to tighten it up with some restrictions here. I hope I'm wrong, but I know that it clearly states this. So my interpretation of this, I don't read this to mean healthcare related expenses, meaning health insurance or even strictly PPE expenses. I read this to mean any expenses that are directly attributed to COVID. So near and dear to my heart, increased accounting fees, increased legal fees, increased software fees. If you've got any special software you got to deploy, telehealth kind of fees, especially because they're not reimbursable under Medicare guidelines. If you had to pay for an on-call service, right, because your administrative staff is out or whatever it might be. So any expense that you had to pay because of COVID, extra advertising maybe, you know, communications with your clients. I've heard it quoted as everything I just listed would be a hard cost. And then they said, what about the soft cost? So for your management team to be sitting on this webinar, learning these rules and reading all the stuff that the associations put out, what about the cost for their time? Sure, they're on payroll, but they're not doing the productive things they would normally be doing. That would be a soft cost. How are you going to prove it all up? What are you going to provide for documentation? That's a little scary to me. Another thing that's scary is that it says 10 days after the close of the quarter. So that they're wanting quarterly reports with this. Again, this is what I was just talking about. Expenses directly related to incurred because of coronavirus or to replace lost income. How do you document these? This is where AlayaCare is going to show you how their software, which it could be, you know, I don't expect that everybody here uses that, and none of us do, but she's going to show you what kind of reports you could be requesting out of your EMR system to try to capture some of this data. So what do we know now? You know, honestly, I started to change this because, like I said, what I know today is more than what I knew, is different than what I knew yesterday. I did change some of it. The original $349 billion in appropriations is gone as of first thing this morning, and they did shut down it says that on the SBA website. Another thing I know is that the large banks are moving very, very slowly. What I don't know is, let's say you did apply with a Wells Fargo and you've submitted all your documentation and you've done what you need to do, but you still don't have anything, you're still waiting. You know, they may have secured an amount for you. You know, your amount may be in part of the spending that's already been spent. I can tell you $349 billion has not hit the streets yet. It has not hit everybody's bank account. So you may be in queue somewhere and you may already be accounted for and you just don't know it yet. I don't know. But what I know are these large banks have moved very slowly. The only providers that I have that have gotten funding are with small banks, small local banks. The documentation required by the lenders varies drastically from vendor to vendor. I shouldn't say drastically, it's similar, but they also kind of want different, like, payroll periods. We've been able to work through that with most of them and try to get them somewhat consistent. But like a lot of banks are requiring like full formation documents, your operating agreement, lots of information. The other thing I know, and where we are, while we're waiting on a lot of funding to happen because we've done all the applications that we need to do, we're really working on what's the next phase. What are we going to do once you get funded? So I'm trying to be very positive, putting those positive vibes out in the universe so everybody gets funded and gets what they need. But the next phase begins, which is, to me, almost more important than the first phase, because you've got to spend it right for it to be forgiven, and really plan it out well to really maximize the benefit that they're trying to get to you. Also, really pay attention to those terms and conditions. I see this as being a very serious reporting burden. Managing all of those sources separately is going to be an accounting mess, because we've recommended to our clients, you know, put your PPP loan in one account, put your provider relief fund in one account, and we're going to have to figure out how to do the accounting on that. We've been working on it. And then also, you know, how can you mix the different benefits, but make sure you're spending each one for the appropriate designated purpose that each one has. So again, planning is going to be really, really important. The problem is we just don't have a lot of guidance yet on it. And one thing I didn't put is, okay, what's next? I didn't put it here, but I'm going to give you a 1-minute spiel on it. So what's next is to fully understand all of the programs that you have applied for and be prepared to receive those funds and how you're going to deal with spending them and doing all the accounting and the documentation so that the banks are happy with what you've done and the government is happy for what you've done and they don't come back and recoup things unexpectedly. So you got to understand all the requirements and how to account for it. If you need to get some professional help, the last thing that I did not add is as this settles down, I will be highly recommending to any of my clients. I'm now learning how crucial it is to have a good established banking relationship with a local bank that you can count on. And when I say local, I don't mean Wells Fargo, Bank of America, or Chase. I personally bank at Chase because I think they have the best online banking, and that was what was important to me. That is no longer what's important to me. What's important to me is that somebody's going to be there to help me when I need the help and just have a person to talk to. I've seen these small banks take these loan applications. Like I had one in queue at the big SBA lender, and he got a local bank that he just had like a line of credit with or something small. He didn't like bank there. And they said, well, you're already an established client, even though you don't have an operating account here. Yeah, we'll go ahead and process it for you. They processed it in about 3 days. And so I just can't stress how important that is to find a bank that really wants to work with you as a small business. We're available to help. All this info will be in there. Hey, Erin, you want me to go through some of these questions, or you want me to kick it over to you? Are you there?
I'm back. Just had to unmute myself. That's completely up to you, Amy. If you want to go through the Q&A and answer them while I'm talking in the chatter channel, we can do it that way.
Yeah, let me do that because there's a lot of them, you guys. All right.
Yeah. And they're good. I've been perusing them. They're good questions.
Okay. The screen share is all yours.
All right. So I'm going to go ahead and share my screen and just get some things out of the way so I can see what's going on. All right, well, thank you, Amy, for sharing your knowledge and for giving me the opportunity to share how an agency's electronic medical records, or EMR, can be an asset to them while they're applying to these programs, well, assuming that they get refunded. It's more important than ever these days that agencies choose the right technology partners to future-proof them against ongoing changes in the market. Having the tools in place to harness your data, to maximize the capacity of your workforce, and to virtually deliver care are just 3 of the many essential features that any worthwhile EMR is going to provide you. And in this age of COVID, the guidance that's being released and updated literally daily, they all stress the importance of using technology to safely deliver care and to, as Amy has stressed, document everything. If it's not in the chart, it didn't happen. Nurses will be familiar with that concept. And this includes, virtual care and all of the expenses related to COVID. So with that being said, today I'll focus on leveraging the data from your EMR to help you claim these relief funds should they get refunded and the application process gets reopened. But now that you've applied, you're going to need to substantiate all of the requirements so that your funds don't get recouped and so that they can be forgiven. So our agenda for today includes tips on how to track and report relevant COVID-19 data. And some of the reports I'm going to focus on lost revenue, canceled visits due to COVID, expenses related to COVID, COVID screening results, and virtual care. The end goal is for you to leave this webinar knowing what data points you should consider tracking and how to get started. And then, as Amy mentioned, one of the requirements for qualifying for the EIDL programs is being able to substantiate lost revenue. And this type of report is not only essential to support the information entered on your application for relief funding, but it's also super important for the purposes of managing your cash flow closely. Due to COVID, I believe we can throw our 5-year financial plan out the window, and maybe even our 1-year plan. The executives I've been speaking to lately are setting monthly financial plans, but they're monitoring them on a weekly basis or even daily, depending on the scenario. Hopefully, the relief funds can make a positive difference here. And I've heard also, Amy, anecdotal reports that they have started hitting bank accounts as of Friday, April 10th, at least for the CMS grants. But this crisis truly highlights the importance of bringing visibility to how your business is performing today. At AlayaCare, we have a department named Alaya Labs that gets to focus on really interesting projects involving artificial intelligence and data and analytics. And one of their top projects right now is creating dashboards for executives that can help track the impact of COVID-19 on their business. And the report you're seeing here is just one of the reports available on the dashboard. This is actual tenant data. And this is sort of a worst case scenario you're going to see. But on a lighter note, I've actually been talking to some of our clients that have been enjoying an increased revenue due to COVID, which is not projected here on the screen. So this report is showing a number of things. The green line is the projected revenue across the timeline that's displayed here at the bottom. And how the projected revenue is calculated, it's looking at the scheduled visits in the future, and it's tying them into the billable rates for those visits. The orange line that appears to be climbing is actual lost revenue. Again, that's the visits that have been canceled and have been tagged a COVID-related reason, including the billable rate for those visits. The dotted lines, this is looking back 14 days and taking the upper and lower threshold for those missed visits, and the blue line is the average lost revenue for the missed visits. So again, not an ideal scenario. Projected revenue is going down and lost revenue is going up. Another element that will help you track lost revenue is tracking canceled visits and being able to differentiate the normal canceled visit for one that's due to COVID. You'll need this info to support your EIDL programs and potentially the CMS relief funds and some other programs that are definitely coming down the pipeline. And as a side note, this is an interesting metric to me. From reading home healthcare news and attending the weekly Home Care 100 COVID task force calls, it appears that the impact of COVID on businesses is all over the place. But I think it's safe to say that many agencies across the nation saw a very sharp decline in visits right after we declared COVID a pandemic. And care models like adult day health, they were hit really hard. Some completely shut down. Many of them remain closed today. So there was an explosion of missed visits. But as the days have passed, already home health is seeing an increased number of referrals from hospitals trying to free up beds. And some of the larger home care and home health organizations are also seeing a spike from smaller agencies closing. In fact, I was on the phone earlier this week with one executive who shared with me that his business has recently grown by over 30% just because he's absorbing the visits from smaller agencies in the area that have either closed their doors or they're turning away clients due to lack of staffing. Anyway, back to the importance of this report. Bringing visibility to the COVID-related cancellations will help you quantify the impact of this pandemic on your business and inform strategic decisions in the near term. In AlayaCare, we provide users the ability to select reasons for different events like cancellations. Each tenant has the ability to build their own cancel codes so that they're customized to their unique needs. And this allows the reasoning to get as granular as possible when you need a report. If you're not a current AlayaCare user, you may want to contact your vendor to see if they're able to help you tag your missed visits in some way for reporting purposes, because that's going to be critical. But in our software, once you cancel a visit, you can select from a drop-down a COVID-related cancellation reason, and then you can report on it using our BI tool. Looking at this report, pulled from our BI tool. Now, this is not actual tenant data. This is demo data or testing data. Well, what you're seeing is a few weeks of information and a few different cancellation reasons, the blue being COVID-related. In week 1, and this must be when we first started seeing cases in the US, you can see that about 16% of the canceled visits were due to COVID. And as the weeks progressed, that's grown to 60%. You're going to want to keep track of these types of things in your EMR. The same concept regarding the ability to attribute an event to COVID holds true for employee time off, which is the next report I'm going to talk about. So if your employees are off due to personal illness that's COVID related, or a family ill member, or a member of the family is ill, you can schedule a period of unavailability for them in the software and attribute that to COVID. Again, users are able to customize their own reason codes. For example, one could create a list of reason codes that differentiates personal illness due to COVID from family illness, from lack of childcare, whatever your needs are. So in this report, we're showing a lot of different columns. And again, this is testing data. So if the numbers look a little off, just know it's not from an actual tenant. What you're seeing, of course, the more important information is the employee, the type of time off, this would be a COVID tag, when it started, when you expect them to come back to work, and then total length of time off. So in this first example, it's a 29-day leave. And the remaining time off column is showing how many more days are left in that original time off period. That's going to help you plan your scheduling and also attribute lost funds for your reporting. Now, I mentioned, as this report relates to the bigger picture right now, there are different unemployment and time off enhancements available to care workers due to the pandemic. Now, thankfully, home care was included in the exemption for extended time off, but that's a different topic. But I mention these because in addition to needing to substantiate the impact of COVID on your business, and for the loans you may apply for, and for the soft costs you may want to track, because resources are required to reschedule clients, to hire new staff, care for the sick team members. Now, you're also going to want to need to supply this information to the Department of Labor, so the people that are claiming these benefits can get placed into the right bucket and not scam the system. And as a side note, I recommend you selecting a few key reports to monitor very closely right now and create your own custom COVID dashboard within your EMR ideally, or externally if that's how you must. But in AlayaCare, you can create a custom COVID dashboard. Reports built with our BI tool can be pinned to a dashboard, bringing the most pertinent reports front and center when you log in. and those can update at a cadence of your choosing. If you're not an AlayaCare user, please consult with your super users or contact your vendor to see if they're able to help you replicate some of these reports and potentially create that custom dashboard for you. But at minimum, you should be able to pull the data on a daily basis as part of the morning routine. A third report I believe is essential right now is tracking all the other expenses related to COVID, and that could get pretty nebulous. As Amy mentioned, one of the stipulations for the EIDL programs and the CMS relief programs is money must be used to pay for expenses that are COVID related. This can include many items such as COVID tests, PPE, mileage, visit premiums that you have to layer on top of visits so that people will go see COVID positive payments, and maybe even your EMR, especially if you're implementing a new solution right now to help you cope with COVID. And pretty much any additional expenditure that you might want to layer on top of a service date that's related to COVID, well, that can be accomplished using a really good BI tool. How you would accomplish this in AlayaCare is first you go into your settings and you set up a few new visit premiums so that your staff can use those when they're completing their visits. Prior to visit approval, they'll need to add the right COVID premium on top of that visit so that it can be reported on later in a report that you're seeing on the screen. So this report, again, this is testing data. It doesn't have very granular categories, but you can name these whatever you need. There's a general COVID-related expense, PPE, testing kits. So you can see the total amount spent. The green line is showing you the average of what is usually spent. And then from that, you can extrapolate above the average how much is COVID really costing your business. Technology. Technology continues to evolve at a lightning speed. And one of the cooler innovations I'm seeing pop up across many of the software vendors right now are COVID screening tools. It's amazing to me to see how our industry has stepped up to create solutions to help keep our providers safe. And tools such as COVID screeners, those are instrumental to that effort and to prevent spreading the disease. Our COVID screening tool, it's integrated into the system so that before each shift, a caregiver is prompted to screen themselves and the client. And the screener, when it's completed on the mobile device or the web app, it updates records in near real time. And the results of those screens are pulled into a report that we deployed across all of our tenants' environments as an operations report. So it can be managed by a staff member that you assign to it. If any of the screening questions are marked yes, like the red ones that you see on the screen here, that gives you the opportunity to be proactive and enact whatever emergency response system you have. That might be quarantining them, rescheduling their shifts. This would also be quantified as a soft cost. And while this isn't directly related to expenses, it will help you track those soft costs. You can extrapolate from it who will be taking advantage of the enhanced unemployment benefits and how many caregivers you need to replace so that your employee census stays consistent with what you reported on your application for PPP. This report is also important for tracking and reporting to your public health officials so we can get an accurate idea of the number of cases across the nation and in your geographic area. Now, if you haven't already done so, please get screening tools out to your caregivers for the safety of your clients and for the safety of your employees. And this is absolutely where our heads need to be thinking. From speaking to a number of our clients, absenteeism is up, and so are visit cancellations. No, caregivers are frightened to report to work right now, And on the other side of the spectrum, clients are afraid to answer the door because no one wants to get exposed to COVID. And if you can assure them that you have taken all the appropriate measures to protect them, it does go a long way. Now, of course, providing them with PPE is important, but honestly, screening can help you determine the right amount of PPE so that you can appropriately ration it in this time of scarcity. So, very important for our industry to focus on these screening tools. And I believe this is likely to stay the same for a while, at least until we have a vaccine in place and herd immunity. And even after that, it's likely that screening tools will play a role in the event there's another surge or, God forbid, another novel virus threat. Now, the next thing I want to touch on is the virtual care. With respect to actual COVID-19 treatment, our health system's knowledge and creation of best clinical pathways is progressing very rapidly. And I believe the need to work towards building standard COVID-19 treatment plans into our EMRs is top of mind here. I was actually on the Home Care 100 call this week where LHC Group was speaking about their SNF diversion program. They developed standard treatment protocols for COVID-19, and they're tracking the cost of delivering those standard treatment protocols, which heavily rely on remote patient monitoring tools. And I believe you're going to see more and more of these programs pop up in the near term and ongoing. Now, let's keep in mind that about 80% of the infected individuals will stay in their homes. And out of the 20% that go to the hospital, only about 5% of those actually need an ICU bed. So we need to have the tools in place to provide care virtually in the home. And if you've been reading home healthcare news, the New York Times, or attending the flood of webinars being scheduled, I believe you already recognize that we're all touting the benefits of leveraging these virtual tools. And in the context of overrun acute care facilities, determining when a hospitalization is required is essential so that we can maximize the beds that we do have. And monitoring biometrics like O2 saturation and temperature via remote monitoring can play a vital role here. Not to mention that remote monitoring gives us the capability to monitor the most frail individuals 24/7. And that provides us the opportunity to intervene early and save lives. So that leads me to talk about virtual care expenses, because unfortunately, virtual care is not a billable service for all service items, but the benefits to the clients are abundantly clear. And this topic, won't get into it, it's a webinar in and of itself, but I do have a few factors that I want to highlight for you to keep in mind. Number one, remember, only a small percentage of COVID patients require hospitalization, but they still require care. And that care is going to be delivered in the home. Some of that care, that can be facilitated virtually to protect the caregiver from the care seeker. Number two, CMS has relaxed a lot of their regulations, and they've issued more 1135 waivers than ever before in U.S. history. As of April 10, there were 80 additional services available under these waivers. Many of those encourage the use of virtual care, but it still amazes me that those virtual visits don't count towards your LUPA threshold. So I hope we figure that out soon. But number three, the majority of states are still lagging when it comes to reimbursing virtual visits for non-skilled home care. I'm going to highlight Missouri here. That's one state that actually does allow wellness checks to be billed in the non-skilled service category. And I believe that we all need to rally with our associations to make this happen in more areas. Now, there's no doubt it would be impossible to facilitate a bath virtually, but things like a wellness check, a nurse or a supervisor triaging a call or a positive COVID screening as part of your COVID emergency plan, there's no reason why those can't count. And I think we should all be thinking in that direction. And number 4, this is hot off the press, the FCC COVID-19 telehealth program is going to provide $200 million in funding as part of the CARES Act to help healthcare providers provide virtual care during the pandemic. This program is going to fully fund telecommunication services, information services, and devices necessary to provide critical connected care until the program's funds have been exhausted. And I encourage you to seek more information about that. It's found at www.fcc.gov/COVID/19/telehealth/program. And we'll be sure to provide you that information with the slides. And as a side note from that, I believe now is the time to invest in virtual tools, and the early adopters need to record the benefits of those tools so the data proves to payers that it's worthy of reimbursement, similar to Medicare Advantage, proving the value of home care. Anyway, so given the fact that telehealth might be a line item on your cost report right now, it's pertinent to track that expense and bundle the tech cost into your COVID-19 related expenses. And when thinking about selecting the right virtual tools, keep in mind that one of the benefits of having a virtual tool integrated into your EMR is the ability to streamline the billing and documentation of that visit record. What you see on the screen is our visit approval window that highlights that the visit was virtualized, and in the EVV, because that's the consideration, it also shows that that visit was a virtual visit. When these visits occur in AlayaCare, the right billing code, the virtual billing code with the right modifiers are automatically assigned to it so that it automates that part of your billing process. Some final thoughts for you. Will the world go back to the way it was? Well, at AlayaCare, we don't think so. So the genie has been let out of the lamp here with regard to virtual tools. Our industry has been forced to advance light years in this area in a matter of a very short period of time. And I believe we will successfully prove that several types of services can be effectively delivered virtually, and they will remain virtual. At least we'll have the option of being virtual. And during this crisis and after, your technology partner is a very important part of your success equation. It can make or break you. Things are not going to return back to the old normal. There's a new normal on the horizon, and technology is going to play an even more important role. So today, we've talked about several data points that you should be thinking about tracking so that your PPP loans can be forgiven, so you qualify for those EIDL loans and grants, and your CMS grant money doesn't get recouped. We've talked about lost revenue, missed visits, expenses, cases, and new technology. Hopefully, I've given you ideas to help you weather the storm. And if I can assist you in any way, regardless of if you use our software or not, please don't hesitate to reach out. I'll make sure my contact information is included in the slide deck we send to you. I am very happy to help. And I'm going to do a plug here. So before I turn it back over to Amy and open it up to questions, I've been asked to do a poll question. So for anyone remaining on the line, my question to you is, are you interested in learning more about AlayaCare and our virtual care suite? If you want someone to contact you about the reports or about any of the products we offer, please in the Q&A section, just enter yes or Y, and we'll be sure to connect with you. So now, without further ado, I will turn this back over to Amy.
All right, I've been working away on answering questions, and I left a couple because they're kind of pertinent to everybody. So let me just try to go through and answer some more of these that I left. One of them says, as a PAS provider, we experience high turnover in providers. here's what I'm going to say. And so basically we've got high turnover. How are we supposed to keep all these people? And then it kind of flows into another question that somebody else asked, you know, yeah, my people don't want to come back to work because they're making more money on unemployment. These are the things that were not thought out by the government. However, I just got to say, if they were, we would not even be talking about any relief right now, because it would still be hung up in the government. None of this is taken into consideration. It's a very, very simple calculation. Are you paying the same? They're going by an FTE count. So if, let's say you usually run 20 providers and attendants and they all do 20 hours a week and 10 of them quit. So now you got 10 providers, but they're doing 40 hours a week or whatever the math is, you know, it's going to be counted on your number of hours that are being serviced. And then there's a question, well, what if my services drop off? Well, then that's a decrease in revenue. And in a provider situation, that's going to impact you drastically. Here's the thing. You may not be eligible for the forgiveness, and you may not be eligible for all the forgiveness. Doesn't keep you from being eligible for the money, right? And so maybe you've got to take it at a 1% loan. 1% is very, very low. So, you know, if I don't have a lot of answers to a lot of these, because it's just not that detailed and thought out, and there's no special, you know, requirements for different kinds of providers and such. So, you know, if your agency has taken a big hit and you've got to reduce staff, their intent was to keep paying people even if you're not providing services. That's their intent. Their intent is to pay people and keep them off of unemployment. But they kind of shot themselves in the foot by giving them unemployment $600 a week extra of federal benefits. So that's kind of why that's not really working out very well. There's another question would be, we spent many hours prior to getting our stimulus on Friday related to COVID. Would these expenses be included in the stimulus payment? That's a really good question. I would think there would be an argument for that. And so that's part of the thing, is we don't know how much are we going to get to argue for this. Are we going to get to prove our case and really argue it? Are they expenses you've already paid? I think a lot of this might come down to a cash basis situation, whether you've paid the expense or not. Again, don't know the specifics on any of that yet. Can losses due to, so I don't know about the, can losses due to frequency of nursing visits that send our episodes into LUPA payments be used as a loss of revenue? I think so. And that's why, like what Erin's point is being able to track this so you can really prove a loss of revenue. One of the questions was, is it going to be based on just the, you know, loss of revenue? Is it this year right now compared to this time last year? I think that's going to be like a starting point. But if you've got better records that can show, because what if you were scaling? What if you were, you know, scaling up and then this hit and you're still way above where you were last year because you're a new provider and you're rocking and rolling, but you've really had a decrease in business? You're going to need a reporting system that can show, I had these patients, I had these visits scheduled, and we just didn't get to make them because of these reasons. You're just going to have to be able to show it. You can't just argue it. You're going to have proof and documentation of it. How would we calculate COVID missed revenue? How would we calculate COVID missed visit revenue lost in the PDGM model? I can't even begin to get into that kind of detail. I'm not sure. You might have to get some guidance with that. Can losses, okay, we answered that. I'm sorry, it's hard to keep track of the market. Thanks, we are 40 million, so I guess no go. Oh yeah, no, if you're a $40 million agency, there's a whole other package of support available for large businesses. I don't know it because it didn't impact my client base. Okay, this one's been asked a couple times. It's a great question. Provider relief funds, do they need to be spent in a specific amount of time? I do not see anything that says that. And I actually see kind of the contrary, because they're going to require quarterly reporting, and it even says something through December 20th, December, the end of this year. So I think you're going to have some time to spend that money. I don't see anything that puts a short timeline on it. Okay. Contract labor is not, this is about the fourth time I've answered this. Contract labor does not count in a PPP loan calculation. It did as of when I went to bed on April 2nd, and we woke up ready to file applications with everything calculated on April 3rd, and they had changed the law overnight. Contract labor does not count because those contractors can go file on their own for their own self-employed business. Can I increase pay to employees and count it for % of payroll? Yes, there's nothing that says you can't give raises and you can't give bonuses, but just remember there's two factors. There's your salary level, but there's also your employee count, and it's not just a straight head count, it is a full-time equivalent count. So to get your full-time equivalent, all you do is you take your total payroll hours divided by the number of hours in that pay period. So let's say you've got an 80-hour work, you're bi-weekly, so you pay every other Friday, you got 80 hours on the check, and you did 4,000 payroll hours divided by 80, that's your number of FTEs. So if you drop your FTE count, so your FTE count isn't the same, but you still pay everyone 70%, okay, so your forgiveness, all of this forgiveness there's 100%, it's not all or nothing. You can have a range of forgiveness, okay? So if you drop your FTE count by, let's say 20%, but you maintain salaries at 75% of what they were or higher, then your forgiveness is reduced by 20% because of the FTE count. There are some creative ways to deal with some of that. I'm almost, what if I am an owner, can I increase my pay? You can, as long as it's not over $100,000. Anything over $100,000 gets excluded. And I think I only have, does this portion of the provider relief terms and conditions mean that we must have billed for a COVID-related business in order to use these funds? No. I don't think so at all. I don't think you've had to see any COVID related patients or COVID affected patients. I think it's because, I mean, you've had to spend money even if you didn't see any patients. So no, you wouldn't have to prove that you've seen those type of patients, if I understood that right. Okay. Does this proportion of the providers? Okay.
Amy, while you're reading, I can probably speak to the question about the PDGM lost revenue.
Okay.
Very similar to, it's the same concept that I demonstrated in the report. If you're able to track COVID-related cancellations, your EMR should be able to attribute that visit with a particular bill rate, which under the PDGM model would be, whatever those rates are, and all of those rules apply for the different LUPAs in the program. So it's the same concept. Once those visits are canceled, you'll be able to pull a report that shows the canceled visits and the revenue that you would have captured due to those visits.
Okay, cool. And I actually, I think I've been corrected. The same guy that asked that question about, do you have to have seen a COVID-related patient? He copied off of the terms and conditions, which, by the way, that document is 20 pages long. So it says the recipient certifies that it billed Medicare in 2019, provides or provided after January 13th, diagnosis, testing, or care for individuals with possible or actual cases of COVID-19. Is not terminated from Medicare, blah, blah, blah. So It does say that you had to have provided care or at least provide diagnosis and testing with possible or actual cases. Yeah, I did not catch that, Chris. I appreciate that. So I hope everybody heard that. The next one says, can we use the HHSC for payroll? Can we use HHSC money for payroll? I'm not sure I really understand the question. You mean the provider relief fund money? Can you use that for payroll? You can. You just have to make sure you're not using it for the same payroll that you might use your PPP loan for. All right, wait. What about additional salary costs? Would timesheets be required? You know, we don't know additional salary costs, it depends on what it is. If you're just giving somebody a raise, there's no need for additional timesheets. We don't know yet what they're going to require. But, you know, if you were to say put a wife on the payroll or a husband on the payroll, you would probably want to document that with some actual work. We don't know how serious they're going to get with this. We don't know if they're going to just ask for a payroll report. We don't know yet what they're going to require. I am not typically super conservative. We are going extremely conservative on all of this because, and again, not to be a pessimist, but you know, we're here in this Medicare world, and just those that don't know me, it's all I know. It's all I've done since college. And you know, I mean, I'm going to just be frank. I mean, how many times have you been screwed over by Medicare? How many times do they say they're going to do one thing, they do something else? How many times do they change the rules on you? I mean, look at it, it's crazy, right? So there's a fear out there, and we're just trying to prepare for the, what is that? Hope for the best, prepare for the worst. We want to be overly cautious because in documentation and spending this money, we have to do it at that time. We can't later figure out the rules and then go back and say, oh no, we really did spend that money for payroll. We're wanting to have really solid paper trails that show where we spent that money on. We are advising using separate bank accounts for that money for each of these different funds. Accounting is going to turn into a bit of a nightmare, but we're going over the top because we don't want the government to have any reason to come back and deny our application for forgiveness if we met those rules of keeping the same number of employees and the same salary levels. Can we use PPP dollars to care for caregivers or
May I add to that?
Huh?
May I add to your point?
Yeah.
Yeah. So with regard to documentation of those extra hours or the allocation of hours to COVID, when you're doing your payroll today, every system has a little bit different take on it. But typically, if you're doing like a holiday pay rate or a hazard pay rate or whatever, you have this layer that you can put on it. And at AlayaCare, we call it a visit premium. So you may want to repurpose some of those premiums and relabel them to COVID, or see if your vendor will allow you to add some additional ones so that the reporting is really easy. And as you're doing your payroll, you can give like a weekly stipend on top of the normal hours, and that could be the COVID pay. You can get really creative in this area. I'm sure Amy has some take on that, but I would highly encourage you to also figure out how to report it, because I have a Medicare background myself, and if you didn't document it, it didn't happen.
Right. One of the questions Ed asked, can we use PPP dollars to give caregivers a frontline or combat pay one-time bonus? Absolutely. And I mean, I'm not, again, trying to be overly aggressive, but that's what I would be doing with any money that you couldn't spend. And we've, in our little calculator, it's basically what we're looking at. All right, you're looking at this much needed to be paid in bonuses. And that's who I would pay it to. Now, again, you're going to have to watch your high-level executives. They're going to be over $100,000. But and I think just from a proper business standpoint, this is the best use of that money, is to pay those frontline workers. I also just had another question. that was a great thought that I had not thought of, so I'm going to borrow it if you don't mind. He said, hey, you know, we've got a couple contractors that have been wanting to convert to W-2. And I'll tell you right now, we're almost out of time, and I'll stay on as long as people want to talk. But he said, can I go ahead and convert them to W-2 employees? That's an excellent idea. I would definitely consider that. I had not thought about it, but part of my soapbox that brings that up, the issue of whether a person is a 1099 independent contractor or a W-2 employee is not up for your interpretation. There are testing that you're supposed to apply to every single person that falls into that. So the employee doesn't just get to choose, yeah, I want to be a W-2 employer, no, I want to be a contractor. And I can speak from absolute experience. And again, you know, you can roll the dice as long as you want, but this is one of those times where there are a lot of people that are getting hung out because they've got a lot of employees that they call contractors. Well, those contractors are not going to help them in this situation. They should have been employees all along. And then, but my experience is it was probably 4 or 5, maybe 6 years ago, I had a large group of providers that got audited by TWC. TWC did not even give them an opportunity to justify that Susie Q was a true independent contractor. They blatantly said any home health agency, if it's not a therapy company, a staffing company, they are all W-2s. And I was beside myself. I hadn't seen it that aggressive. They said that's Texas stance and they're not going to argue it, and they don't have any time to argue it with me. So their stance is in a home care, there are no such thing as independent contractors other than your staffing companies. I think that was a little outrageous, but it was not enough money for my client to fight it. Couple more questions. How do I get a copy of the slides? So you're going to get a follow-up email. I sent it to go out in 2 days. That gives me time to get our video edited, and because there's going to be some editing to the beginning of it that I need to wipe out. I'll get the video edited, I'll get it uploaded to YouTube, and I'll get the link copied, and that'll go in the follow-up email to the all attendees, and it will, I'm not sure if I can include the attachments there. I've got everybody's email address from registering, so we'll make sure you get them. So you may get a follow-up from us and a follow-up from Zoom, but we'll send them out for sure. That's why I write mine with a lot of details, because I want you to be able to look at them later. And when you refer to $100,000 earning, are you talking about annual expected or, okay, yes. So on $100,000, it's annualized. So if they are going to earn more than $100,000 in that year, the amount over that is excluded. And I don't have the number in front of me, but 100,000 divided by 24 pay periods, that's how much you get to count for each pay period during the 8-week period. There's probably some ways to manipulate that too. I haven't thought of that yet, but I'm sure there is. Whoops, cancel. Okay, that's all I got. We appreciate you guys joining us. It just keeps changing. We'll do it again if there's a lot more changes. Just stay tuned. Thank you guys. Thanks, Erin. See ya.
Thanks, Amy.